Hi, and good morning. This is Mr. Reyes once again. We are continuing our conversation in phlebotomy in chapter 10 of our textbook. Today, we're going to be discussing topics, a very specific topic, which is capillary punctures and the equipment that is related to it. It's a very important part of the phlebotomist duties. Capillary punctures are performed on a routine basis, more so in other specific areas of the hospitals, especially in the newborn areas, the pediatric areas. But of course, they're also performed in the adult sections as well. So we're going to continue the conversation. We're going to start off by discussing some of the equipment that is needed or utilized in this area. So why do we have to collect capillary punctures? They are necessary at some point for various reasons, which we'll discuss. So let's delve into it and talk about some of the topics that we're going to be discussing today. We're going to be looking at some of the terminology. So again, it's very, very important that you are familiarized with the terms that are discussed in this chapter, such as intracellular fluid, lancets, microhematocrit tubes, and so on. It's very, very important because if you don't have that terminology understanding, then you may perhaps miss some of the other required knowledge that you have. So again, go back and look at the terminology that is used so that you can better understand the conversation. We are going to identify capillary puncture equipment and list the order of draw because there is a slightly different order of draw for capillary punctures versus venous punctures. And we'll look at that in later on this chapter. And we'll describe the theory behind capillary punctures. What is the composition of a capillary blood sample? What is in that blood? And we'll discuss that more in detail so you can understand why we have to make sure that we label specimens with the particular types of blood specimens. We're going to identify the difference again between capillary, arterial, and venous specimens, the composition, and reference values or ranges. We look at capillary punctures. When is it indicated? When is it not indicated? And of course, demonstrate the knowledge of site selection criteria. Where can you perform these punctures on newborns, pediatrics, and adults? So it's very important that you know when it is a good idea and when it's not. We'll also look at how to collect capillary specimens, which is a procedure we're going to be performing on adults, infants, and children. Of course, we're not going to be doing it on infants or children here, but we will be performing it in adults. And we'll describe the specimen collection procedures and explain clinical significance of capillary blood gases, which is also a common exam that is performed in adults, more so than children, but it is done a lot in newborns when they have they're born with respiratory problems. Neonatal bilirubin, that's another very common newborn screenings. We'll look at how to perform a newborn screening test and tests that cannot be performed on capillary specimens. As we said earlier, specimens for capillary punctures are very limited in the amount of blood. Therefore, you cannot perform every single test on capillary blood. So some people don't understand that, but we'll explain why. And of course, we'll learn how to prepare routine and thick blood smears. We'll be practicing those procedures later on. And we know now that there is equipment that actually can help us perform the procedure perfectly every single time. But for your knowledge, you should be aware of peripheral smears as you will see it. You will see questions about the topic in the national certification exam. Why do we need to collect peripheral smears? We'll look at that in a bit and identify tests performed on some of the smears. What tests are performed, why are they done, and what kind of patients require this type of collections. All right, so we've introduced ourselves into the capillary puncture equipment. We've seen some of the equipment that we're going to be using, and obviously criteria that has to be for a lancet device to be considered a lancet device is that it has to be sterile. All the specimens are sterile, such as the one that we'll be using here. This is a lancet device, okay? And it is very commonly used in this manner. Of course, there's various presentations, colors, and so on, but they have to be sterile. They cannot be used more than once. They are meant to be disposable. They have a sharp point inside them, okay, and it is retractable. That is one of the OSHA requirements that defines a lancet device. It has to have a permanently retractable needle or blade. That means when once you activate it, it cannot be activated once again. All right. So these again, they're designed for either finger punctures or heel punctures, as it is on newborns. Finger puncture lancets, again, they come in various forms, and the color will determine the depth of the puncture. Okay, that means how deep is the needle going to go in the skin. All right, so as we can see, we don't want to use one that is too deep on an infant, because it will cause damage to the bone, and we'll talk more about that in a minute. So they come in various presentations. Okay, but always remember that the OSHA required Lancet safety feature is a permanently retractable blade. If it doesn't have a permanently retractable blade, then it is not does not meet the criteria for a Lancet device. All right. Heel puncture lancets are a little bit different. If you look at the PowerPoint slides, you'll see that there are different colors again. They come in various shapes because of the depth of the puncture. Sometimes you need a deeper puncture, and you are able to collect a good amount of blood from that puncture, because the lancet device itself has a wider blade, and it makes a bigger cut, and won't have as much trouble collecting the specimen versus using the regular lancet device. So make sure you make the proper selection of equipment when you're going to perform a newborn. The last thing you want to do is lose your blood flow and having to puncture the infant once again, which is not a good idea. Now, once you perform your lancet, your puncture, you will be collecting specimens in micro collection containers. These are very small containers that have a limited amount of space for blood. They're plastic. They used to collect very small amounts from capillary punctures. Some come with a narrow capillary tubes attached, such as the ones we've seen here, the purple. And these little tubes will help you to draw the blood into the micro collection container by an action called capillary action. It means that the blood will automatically fill the space in the tube and drop into your micro collection tube. And we do this using the proper technique so that we don't collect excess intracellular fluid. All right. They are colored just like your vacuum containers. So that means they have a lavender color. It means it has EDTA and so on. They have expiration dates and so on. So make sure that you check your equipment before you're going to be using. All right. They should have markings for minimum and maximum fill levels so that you're able to collect the proper amount of specimen. There are other various presentations of these, but and again, you're going to have to follow the order of draw. So you see the colors in picture A. The capillary specimen collection is useful for pediatrics. All right. Remember that we're going to be talking about the different amounts of blood that you can collect from newborns, from pediatric patients, and even adults. There is certain amounts of blood that you can collect at once, and it's very, very important for you to remember that. You don't want to exsanguinate someone or cause complications for the patient because you drew too much blood. Okay, so again, capillary specimen collection is especially useful for pediatric patients in whom removal or larger quantity of blood through venipuncture can have serious consequences. So you must always verify with your physicians, for the primary caregivers, the nurses, whoever's in charge of that patient, so that you can collect the right amounts of blood. There's other equipment called micro collection uh, tubes. Okay, now these containers are very, very small, and they're for the most part used to collect hematocrit or blood specimens. Okay, the hematocrit is part of your blood, and it gives you a percentage of amount that is hemoglobin that is in your blood. Okay, so this hematocrit tubes are very useful for that. Again, when you're trying to limit the amount of blood that you're going to be collecting, these disposable narrow bore plastic or plastic devices will be the best equipment for, again, for newborns or pediatrics when the infant already has low blood counts. So make sure you're familiar with it. These again fill by capillary action just like the other tubes. So as soon as you You present the microcollection tube into the blood will automatically fill that space. These tubes are filled with ammonium heparin. So that means that they are coated with heparin, which is an anticoagulant, and therefore the blood will not coagulate. And you need very, very small amounts of blood. Maybe a drop or two will be enough to fill these bloods. They're used primarily for hematocrit determinations. After you fill them with blood, you must have to seal them with a plastic or a clay sealant. So this is part of the equipment that will be requiring when you're performing this collection. All right, there's other equipment that you're going to be using as well, which is not too common. We don't collect capillary blood gases on infants very often, but unless they require it because of either they're having shortness of breath or they're having discoloration, they look a little bit purplish, bluish, right? So, or cyanotic is the term. We may need to collect capillary blood gases on these infants. Okay, so capillary blood collection tubes have several things, several parts to that equipment. Okay, it's like it comes in a kit. So capillary blood gases include the narrow bore plastic capillary tubes, which are very small, a stirrer which goes inside the tube, a magnet that is used to move the stirrer back and forth, okay, and plastic caps, obviously to seal the collection tubes. So that all that is an equipment. Now this specimen requires special handling, so you have to be familiarized with this handling process, which usually includes placing these collection tubes in ice slurry, not ice cubes, not ice water, but ice slurry, because you want these specimens to be not frozen, but very cold to minimize the amount of oxygen that is being used by the cells in the blood. Okay, so again, capillary blood gas equipment is used very not too often, but you have to be familiar with it. We're going to be working with microscope slides. Okay, these slides are the ones that are used to perform blood smears. And as the word implies, a smear, right, is when something kind of just uh, is smeared onto a glass. We're going to be using food coloring to perform these blood smears. Okay, it's not as easy as it sounds. It does require a lot of practice and very good technique to make an acceptable smear. All right. Now, however, there are new machines that can perform this for us. So that is a very useful machine. We don't have to waste time. It's done perfectly every single time. So again, we'll be looking at that later. Warming devices. Warming devices are very, very important. Now, there's pre-manufactured devices that you can use to arterialize your specimen. To arterialize means to bring more arterial blood to your puncture site. So we're going to need a warming device. Again, we don't want to use warming devices directly on the skin. We're always going to put a little barrier, especially if you're performing this a okay, you have the syringe. The syringe is the one that is used to collect the specimen. Now, again, this may not be within your scope of practice. This may be for an advanced phlebotomist or even respiratory therapists, which are usually the ones given the task to collect capillary blood gases because they are trained to perform this procedure. It does require a several steps, several things that you have to do before you collect the specimen. So again, if you're not knowledgeable in this specimen collection, do not perform it because you may cause injury to the patient. All right, the specimen will be collected from an artery. Okay, so you need your arterial blood gas syringes, which is the one you're going to be collecting the specimen with. Your collection tubes, which are very, very small. The stirrers that are going to be used to mix the blood in the tube, and your plastic caps that go on each end so that obviously the blood doesn't spill. So that is what the equipment that is used. There's a syringe, that is your collection tube. There are your stirrers, and your magnet. Okay, so that is some of the equipment that is used. Again, you may not get to use it if you're not well versed in this technique. So what is a capillary specimen? What kind of blood are you going to be collecting during your procedure? So our arteries bring nutrients, hormones, oxygen to all the tissue in your body. Every single cell part of your body gets these, right, via your arteries, right? Your arteries are the expressway of nutrients and hormones and blood gases and so on. Once that all those nutrients and oxygen are delivered, then it has to make its way back to the heart, so it can go to the lungs, pick up oxygen, and again pick up more nutrients. Right, it goes to your intestines, picks up nutrients, and so on. So once it makes its way back, before it does makes it into the veins, it has to reach an area called the capillary beds. The capillary beds. I think of it as a small marketplace where everybody goes and exchanges, goods. In this case, we have your arteries, which branch off from your heart. They all start from here. They branch off, and they get smaller and smaller as they go away. They become what we call arterioles, and then as they get smaller and smaller, they become capillary beds. Okay, capillary beds. The same thing is for the veins. The veins also branch off from your heart, and they return. Okay, they return back everything that was dropped off from the capillaries, all the waste, everything that is not utilized, any gases that are released from the cells are picked up in the capillary beds and pushed through your veins, which are in this case called venules, or very small veins, and then make its way back into the back to the veins and back into the heart. This is caused by the heart pumping. Okay, the heart is continuously pumping, so all the blood has been pushed through the capillary beds, back into the veins, and then back into the heart, and so on. Okay, so this is, remember, the cardiac cycle. This is what happens every single second of your life. Okay, so when you perform a puncture on a capillary bed, in this case, let's say the fingers, okay, you will be collecting a sample with a mixture of arterial, venous, and capillary blood. Very important that you know that, okay? So it's not either arterial or venous, it's a mixture of all these. So you have a lot of different kinds of fluids that you will find in this sample, all right? In between the cells, there's also something we call interstitial and intracellular fluid. So again, you have even more different kinds of fluids that are going to be in the sample, but we're going to try to limit the amount of interstitial, right? The fluid that is in between your skin, and then we have fluid that is in the cells, right? And then we have your capillary blood, all right? However, this sample most closely resembles an arterial sample. Why? Because of the force that is being produced by your heart as it's pushing the blood into it. You're going to find that a lot of this blood is more more arterial like than venous like. Okay, so keep that in mind. So for that reason, we're going to have different reference values. Okay, we're not going to have the same values that we use for veins because they're more arterial blood. So we have to keep that in mind. The capillary reference values may differ slightly from venous values. Maybe not a whole lot of difference, but again, we have to make sure that we let our technologists know what kind of sample we're providing for them. Glucose concentrations are higher in capillary blood. Again, why? Because you have your sugars running in your arteries. And since your capillary samples are more arterial, then we have higher glucose concentrations. And that's why the main reason we perform a capillary puncture to collect a glucose sample when we cannot collect a venous sample. Okay. Other elements in capillary blood samples are your total proteins, calcium, potassiums, are lower in capillary blood versus venous blood. What are the indications for capillary puncture? When do we need to collect a capillary puncture in adults or older children? When the veins that are available are very fragile or must be saved for other procedures. Perhaps the patient requires some kind of a surgical procedure on their arms, and the physician has ordered no venipuncture on that specific arm. They might have to collect a venous puncture. Again, you must keep in mind what kind of tests you need to collect for. You cannot just collect any kind of specimen or capillary because it's not going to be sufficient blood for it. Or when there's been various attempts to collect from a vein and nobody has been able to collect it, you might consider a capillary puncture. Again, only if the test can be done with that small amount of blood. The patient has clot forming tendencies. Many times we will perform punctures on patients that clot very quickly. The blood will stop flowing right away, and this may be a reason why you can collect a capillary puncture. The patient is very, very afraid, okay, of needles. Okay, not that lancets are not needles, but they can't see it, so that may help them cope with that procedure. So that's another reason. There are no veins accessible. Maybe the patient has IVs in both arms, or they have dialysis graft in both arms. Maybe they have mastectomies in arms, etc. If there is no possible way we can puncture the arms, the veins in the arms, then we might have to consider a capillary puncture. Point of care testing. Point of care testing is something that is done every single day by phlebotomists and other healthcare team members. We do usually glucose checks. Every day we perform glucose checks on patients. Diabetics, we have to perform this test every single day, various times a day. So it could be considered, it is a point of care testing because it is done at the bedside of the patient. That's why we call it point of care. We'll talk a little bit more about that later on. Now, what about children? When can we perform capillary punctures in infants and very young children? Because of the small blood volume that they have, okay, they have a higher risk of developing iatrogenic anemia. You remember that term, iatrogenic anemia. This is when we cause anemia by performing too many blood draws. Okay, iatrogenic anemia. So make sure you know that term. You will see it on your national certification exam. We have kids that have a risk of cardiac arrest because of the low blood volume. You can perform capillary punctures. In this case, you may perform either heel punctures or maybe finger punctures. When venipunctures are very difficult, it may damage the veins or other tissue around them. If they're deep veins are hemorrhaging, they have blood clots or infections, or when there's the risk outweigh the benefits, we prefer to go with a capillary puncture whenever possible. Again, we have to keep in mind the type of test that needs to be performed and needs to be processed so that we can collect enough blood for the test. Risk of injury due to restraints needed for venipuncture. Sometimes, well, many times, kids will not cooperate, and holding kids in place, it can become very challenging. They're, can get a little strong, and if we're not careful enough, we can actually injure them. So, in that case, we would just perform a capillary puncture. Capillary blood is preferred specimen for some tests. Some physicians will specifically ask for a capillary blood sample versus a venous blood sample. Tests that cannot be collected by capillary puncture. Most erythrocyte sedimentation rate methods. ESR, or erythrocyte sedimentation rate, is a test that is done to measure inflammatory process. Okay, when somebody has perhaps rheumatoid arthritis or some other kind of autoimmune disorder that it causes inflammation, these doctors will order an ESR, or erythrocyte sedimentation rate, but it cannot be done on a capillary puncture. Okay, that for sure, that's going to be done has to be done in a venous sample. All right. Coagulation studies cannot be done in capillary punctures because there's not enough plasma that will be done, taken out of the blood sample. You wouldn't have enough plasma to run the specimen in the machines. Blood cultures cannot be performed with capillary blood. That's just not enough blood to be able to grow enough bacteria in the blood media. Okay, in the bottle media. Tests that require large volumes of serum or plasma, obviously, again, cannot be performed by capillary puncture. So every time you're going to collect a capillary puncture, you have to keep in mind what test is going to be performed. And if it's one of these coagulation blood cultures or ESRs, remember that is not going to happen. Now, there's some patients that will insist on you collecting a capillary puncture because they don't know and they think that every test can be done with a capillary sample. So you might have to do a little bit of explaining for them. But just keep that in mind. Don't bring specimens in a capillary tube that cannot be performed or processed that way. Potassium levels, the order of draw. We said earlier we have a slightly change in the order of draw for capillary punctures. And the abbreviation that I use to remember this is called BEOS. BEOS. B is for blood gases. Blood gases are always collected first when you're doing capillary puncture, followed by your EDTA specimens, which can be various. You have other additives after that. And then lastly, your serum specimens. Remember, the serum are the ones that clot. Okay. So you have blood gases, EDTA, other additives such as your heparins. And lastly, you're going to have your serum specimens, which are the ones that coagulate. Right. So remember that. Potassium levels may be falsely elevated if there's tissue fluid contamination or hemolysis of the specimen. What is hemolysis? The breakdown of red blood cells. So remember that term, hemolysis. Hemo is blood, lysis is breakdown. Now, there are four steps for the capillary puncture that are the same as a vein puncture. Remember, you have to have your requisition, right? You have to introduce yourself, get consent, and so on. So the first four steps are skipped, okay? So review and accession test request, approach and identify the patient, prepare the patient for the procedure if they understand. If it's child, you talk to the caregiver. Verify any dietary restrictions, latest allergies, surgeries, anticipate any possible complications if they have a history of fainting or fear of blood or whatever the case may be. Make sure that you prepare for that. All right. Of course, you're going to sanitize your hands, put on your gloves before you start the procedure. All right. Now, in this case, you're not going to put any tourniquet. Okay. You're going to be performing the capillary puncture on a finger. All right. You're going to support the arm on a firm surface, hand extended and palm up. You're going to be looking at the third and fourth fingers, right? One, two, three, and four. So these are the two fingers that you're going to be performing a capillary puncture in on children 1 year older or in adults. Okay. Infants 0 to 1 will be done in the heel puncture. The young child is usually held in a lap by the parent, right, or guardian, and the infant will be usually in a bassinet or in a crib where you can perform this. However, there are some things that you have to consider when performing heel punctures in one of those areas, in a bassinet or in the crib. Hold 3 or 4 fingers and not toddler's fingers. Why? Because if you hold only two and this child starts to move around and they twist and turn and you might injure their little fingers. So by grabbing more than three, it gives you a bigger surface area that you can hold on and it's safer for the child so you don't hurt their fingers. In step 6, we're going to select the puncture site. Okay, usually it's going to be, we're going to puncture in the lateral sides. It'll be the outside or the medial side, lateral or medial sides of the distal end, this part, okay, of the finger. Okay, usually you want to arterialize your specimen. Remember, use those warming devices over the area so you have more increased blood flow to the area. Makes it easier for you to collect your specimen. It'll be faster. So the skin is warm pink and a normal color. If you see that the hand is purple or blue, you definitely want to arterialize it. You want to warm it up before you even start. Do not puncture over any scars or cuts or anything like that, as you're not going to get any blood return. All right. If it's swollen, obviously, just like in venous punctures, you do not want to perform punctures over swollen areas because you're going to be contaminating your specimen. Okay. Or you might even cause infections. On adults and older children, all right, the palmar surface or distal end segments of the middle ring, all right, which is 3 fingers, all right, and the central fleshy portion of the finger. So you're going to try to puncture, okay, the fleshy part, not on the side. You don't want to get on there because there's a bone there and you might cause infection to the bone, which is called osteomyelitis, okay. In infants, on the plantar surface of the heel. So if you picture this as a baby heel, okay, you have the sides of the heel. Okay, here's the heel bone. You're going to look for these sides. So you can create a V from the between the first and second toe and the last fourth and fifth toe and make a V. Okay, and you're gonna puncture on the sides of it. Again, you want to look for the lateral edge where it's fleshy. Okay, and it's meaty, that's where you want to go in. Now remember never to puncture an infant more than 2 millimeters deep. You need to remember this. Never more than 2 millimeters deep, as you might cause injury to the bone. And if they get an infection, you cause something we call osteomyelitis or if it's in the joint of the bones, then you might cause osteochondritis. Those are two terms that you need to be familiar with, as they are part of your terminology in this chapter. Okay, so correct selection of puncture site. Again, make sure you select it correctly. After reading step 6, confirm that you know how to select a safe site. Why do you not want to perform more than 2 millimeters as a requirement? Because as you go deeper into the skin by maybe depressing the lancet too hard on the skin, okay, you need to go deeper, and the deeper you go, the less blood flow you're going to get. Remember, most of the capillary beds are right on the surface, right below the surface of the skin. So that's where you want to puncture, right below the surface of the skin, and not go below that. Okay, the vascular beds are right below the skin. The epidermis, they are in the dermis, right? So epidermis is what we're looking at, and then you have your dermis, which is right below. This is where you have all your capillary beds. This is where all the rich blood is in there. Okay. So recommended site and direction of the finger puncture. Again, for the hand, you want to puncture on the meaty part, but more so on the side. This will help you collect your specimen. As you're collecting this way, the blood drops. Okay, make sure you do not make any contact with the skin. Make sure you do not scoop. Okay, you do not perform any scooping motion. Try to do that. Just let the drop, press and release. Press and release, and the blood will come into the tube by itself by capillary action. Okay, same thing in the infant heel. Right, you're going to be on the sides. Again, make sure you warm the site. Warming the site helps tremendously to increase blood flow. All right, so when you're performing the puncture, you squeeze and release. Always remember, never milk the fingers or the sites. Okay, sometimes you see a lot of people do this. Okay, you do not want to milk. Okay, you do not want to do that. Why? Because you're pushing intra and extracellular fluid, okay, into your sample, and you're contaminating your sample. Okay, it's going to be perhaps even rejected. So make sure that you don't milk the finger. Okay, just press and release. Let the finger fill with blood again. Press, get your sample and release, and keep that motion going. Okay, if you had good arterialized, if the site is warm, you should not have any problems collecting your specimen. Okay, so again, make sure you warm the site. Wrap the site for about 3 to 5 minutes, probably not more than that. You can use a moist washcloth if you don't have one of those pre-manufactured kits, towel, or even sometimes even a diaper can work. Okay, clean and air dry the site with your normal antiseptic, which is isopropyl alcohol. Allowed to air dry. Do not blow dry, fan dry, or pat dry. You must let the antiseptic do its work. After you puncture the site with your lancet device, make sure you wipe off the very first drop of blood. Okay, why? Because that first drop of blood is considered contaminated. All right, we don't want that in our sample. So make sure you wipe that first drop of blood. Okay, make sure you have gloves on, of course. Your equipment should be ready right next to you within the reach. Select your collection devices and start collecting your specimens. Okay, open always every package in front of the patient, in front of the caregiver, right? The guardian, so they can see that you are using brand new sterile equipment. It just gives them that reassurance that you're using proper equipment. Step 10, puncture the site and discard the lancet. You know that these lancets are one single use only. You cannot reuse them even if you try, because of the permanent retraction of the needle or blade. You cannot reuse them again, and that is OSHA requirement. Grasp the patient's finger between two non-dominant thumbs and finger, again, or the heel. If you're grasping the heel, grasp the foot gently by the heel. Okay, so you're going to be compressing and releasing. Okay, you can also encircle. Now this is not heel, but you can also encircle the heel. Okay, so that it allows you to create that pressure on the heel to get more blood flow going. Deeper skin punctures are more painful because pain fibers increase in abundance below 2.4. So again, how can you cause pain? When you are placing the lancet on somebody's finger and you press the lancet device too deep, too hard on their skin, they will actually get the needle or blade will go deeper, and that is what causes more pain. So try not to go, as long as you make good contact with the skin, that's all you need. And remember that your lancet device has to be perpendicular perpendicular to the whorls of the fingertips. Okay, to remember that. If you do vertical, what's going to happen is that your sample is going to smear down the finger and you will not be able to collect. It's going to be very difficult. Okay, so make sure it's perpendicular to the whorls or fingerprints of your finger. All right, step 11. Wipe away the first drop of blood, which we said, again, is typically contaminated with a lot of excess fluid. Fill and mix tubes containers in the order of draw. We said BEOS, blood gases, EDTA samples, other additives, and then finally your serum tubes. Collect slides first. If you're going to collect a blood smear or a sample for a blood smear, it has to be collected first. Collect other anticoagulants next and serum specimens last. Touch collection tube or device to drop off blood. This is when you're going to collect the peripheral smear. You're going to be grabbing the slide and you're going to be making very little contact with the slide. The drop of blood will go on your slide. Okay, so you have your finger and you're going to be placing your finger right by the slide and the drop will automatically go on there. Okay, once your drop goes on there, you're going to grab another slide. You're going to be bringing it at about 30 degrees and you push your slide there. Now, when the second slide makes contact with the blood is going to run side to side. It's going to run from here to here. And at this point, with one motion, you're supposed to push forward, right? And make what we call a feathered edge smear, okay? It is not an easy task. It takes practice, okay? So this is what you use. Put the drop of blood here. Bring your second slide here. Let the blood go from side to side and then push forward and you should be able to make a peripheral smear that way. Again, there are certain criteria that you have to meet. We'll talk about it in just a minute so that you can create a good blood smear sample. Okay. Fill and mix any tubes, containers in the order of draw. All right. Again, blood gases, CDTA, other additives, and then finally your serum tubes. Place gauze and apply pressure. As the patient to apply pressure, keep the site elevated to minimize the amount of blood that is going to be bleeding or coming out. And label your specimens in front of the patient at the bedside and observe any special handling. Does your specimen need to be put in ice? Does it need to be covered from light, protect from light? Does it need to be kept in in a warm block, etc.? So make sure that you follow the specimen handling instructions, and we'll discuss that in another chapter. Check the site after you're done. Make sure you always go back and check the site, make sure they're not bleeding, and apply your bandages. Once, if the patient is doing okay, you're going to be assisting them to getting off the chair and assist them back to their lobby or wherever the patient may be at. Dispose of any used contaminated materials and the biohazard. Remember, only sharps go in the biohazard. You do not throw any gauzes or gloves in the biohazard or the sharps container. Thank the patient, remove your gloves and sanitize your hands. Hopefully you had a successful venipuncture. Transport your specimens back to the lab, especially if they ordered stat. You must remember that if they order stat, you need to return them so they can be processed immediately. Okay. Okay, so we continue our discussion here on capillary punctures. Now, capillary blood gases are not usually collected in adults. It's very rare that we actually collect them in adults because for the most part, it is pretty safe to collect arterial blood gases from an adult from usually we call the radial arteries. Okay, usually the respiratory therapists are in charge of this, and they're the ones to collect these kinds of specimens. So you should not be worried too much, and you should not perform this procedure unless you've been trained to do so in your facility. Now, in children, sometimes capillary blood gases are collected because obviously arterial punctures in infants is very dangerous. So capillary blood gases can be collected from a heel puncture, just like or even children more than 1 year old. You can also perform capillary blood gases on fingers. So those would be the only two reasons why you want to collect capillary blood gases on these two demographics, these two types of patients. But again, you have to consider the risk and benefits of performing these procedures on them. Now, there are other tests that are done on kids, such as neonatal bilirubin collection. Bilirubin, you might remember, is the excess production of bilirubin because of breakdown of red blood cells. When babies are born prematurely, the red blood cells tend to break down a lot faster and therefore creating excessive bilirubin. The excess bilirubin flows in the blood and creates a yellow discoloration on infants or babies. So that's why you see a lot of babies being put under what they call a Billy light or ultraviolet light. This ultraviolet light helps break down or minimize the breakdown of red blood cells, therefore reducing the amount of bilirubin. Now, when you have too much bilirubin in the bloodstream of an infant, it can be very hazardous to their health because it can cause brain damage. So by limiting the amount of red cell breakdown, you're reducing the amount of bilirubin in the bloodstream and thus decreasing the risk of this infant developing brain damage. So that is one of the tests that is on a routine basis in the newborn nurseries. So now you know why the infants are placed in the Billy light. Okay, it's a very important test. It has to be done correctly so that we can get accurate results, so kids can get the right treatment. Other tests that are done with capillary punctures are newborn screenings, and these are done very, very commonly. Newborn neonatal screenings are done, they're required by law. Uh, every hospital has to perform the newborn screening test on every single child, and they're done usually twice during their stay in the hospital. One of the common tests that are evaluated or noted is called PKU or phenylketonuria. Phenylketonuria is a genetic disorder characterized by a defect in the enzyme that breaks down the amino acid phenylalanine. Phenylalanine is one of the proteins that our body requires. So if you don't have this protein, then your body is unable to process a lot of things because we function a lot with proteins. And if your body cannot break down PKU, then you will not have phenylalanine, and therefore you're going to have some growth problems. Without any intervention, phenylalanine, all right, which is in most all foods, okay, you will have impaired growth, impaired development, and so on. So it's very important that this problem be identified, okay, right from the very beginning so that you can identify and take any necessary action uh, uh, before the child starts to develop. PKU cannot be cured, but phenylketones in the urine, but it can be treated with diets low in phenylalanine, okay? So again, phenylalanine is almost in every other food that we eat, and that's why it's important that babies are identified with this problem if they have it or not. Excess phenylalanine in the bloodstream can cause brain damage. Okay, so again, it's very important that this problem be identified very early in the stages of birth. Another problem is hypothyroidism. Hypo means low. Thyroid obviously refers to your thyroid gland. Okay, hypo means low function of your thyroid gland. If the child is born with this problem, what can happen? Well, the thyroid hormones play a big role in your metabolism, in your growth, and so on. So if this gland is not functioning at its right level, then obviously the child will not develop correctly. Okay, you will have a lot of growth problems and brain development problems, maybe learning disabilities and so on. So again, this is one of the newborn screenings that's performed routinely on children as soon as they are born. Another test that is also done is galactosemia. It's one of your newborn screening tests. And this is an inherited problem. Sometimes it runs in families caused by a lack of enzyme needed to convert milk sugar, galactose, into glucose. So if most babies are obviously raised with milk, okay, and they must have the ability to convert galactose, which is in your milk, into glucose. And if they don't have that ability, obviously they will not be able to function normally. Okay, they will have low glucose levels. Okay, and with low glucose levels, obviously nobody can survive. We all need to have sugar in our bodies, and an infant that has not the ability to to utilize to make that conversion from galactose to glucose, well, can obviously is going to have a lot of metabolic problems and can perhaps even die. So it's very, very important that this screening be performed very as soon as they are born. Another common test that is also performed in immune screening is for cystic fibrosis. Cystic fibrosis is a condition where your glands produce too much mucus or phlegm, and it impairs the normal functions of the cells around it. Okay, so if those cells form or produce rather, they produce too much waste or too much mucus, then it's going to stop or hinder the ability of the organ itself to function normally, therefore affecting largely the overall function of the system. Okay, every system has different organs. Like if one organ fails, then there's going to be a domino effect. Okay, so there's other problems that can occur. Cystic fibrosis is it's a genetic problem caused by one or more mutations in genes that directs a protein responsible for regulating the transport of chloride across cell membrane. So chloride, some people call it the chloride test also. Okay, chloride is always comes together with salt. So sometimes they even call it a sweat test. So they'll grab a sample from the skin, okay, and if they see there's too much chloride in that sample, then they can continue the investigation to see if the child has a problem with cystic fibrosis. Very, very, it's not too common, okay, but it is a chronic problem. If a child is diagnosed with cystic fibrosis, they're going to have a lot of metabolic problems, a lot of problems with nutrition, and sometimes, many times, with respiratory problems. They end up being requiring a tracheostomy to be placed in them so that they can breathe easier and better. So again, most sweat tests are ideally performed when the infant is between 24 to 72 hours old. So right away, as soon as you're born, this test has to be performed so they can identify any problems. So how do we collect um, newborn screenings? How do we collect newborn screenings? We collect them by using what they call a blood spot collection. Okay, blood spot collection. All right, so I think we lost our connection here for just a second, but I was just talking about the blood spot collection that has to be performed correctly using a lay your forms on that area and they're contaminated, then your specimen is going to be contaminated. Now, the circles have to be filled completely, okay? So when you put your heel, the paper against the heel, make sure that you have a good blood flow, okay? You don't want to go to way over the circle, okay? You want to just enough to fill that little circle. And when you fill the circle, you turn the paper over and make sure that it went through the other side. Okay, now once you collect the specimen, you're going to have to lay it on a flat surface so that it dries out. You do not want to hang it as the blood may smear down. Okay, you do not want to overlap these papers on each other because they will stick. Blood has a sticky or will clot, right? So it has a tendency to um, to stick to anything. So make sure that you don't overlap these papers when you're collecting them. Again, remember the substances that are have been identified as contaminants in newborn screening specimens include alcohol, blood formula, lotion, powder, and urine. So make sure that these are not in your specimens. I touched a little bit on peripheral smears. Um, these again are done using a capillary puncture. You're going to be on adults. We'll be using obviously the third and the fourth fingers, either or. Okay. Remember to arterialize your specimen so you can get a good blood flow going. You're going to grab your slides. Okay. You're going to be putting it against the drop of blood. Make sure you wipe off the first one. Okay. You know, put your drop of blood here. Turn it over, and with the second slide, you're going to come in here about 30 degrees, and you're going to push it forward. You want to create a feathered edge. Okay, you're going to create a smear that is acceptable. What is an acceptable smear? The smear has to be about 2/3 of the slide. It has to fill about 2/3 of the slide. So 1, 2. Okay, it has to go from thick to thin, and the edges have to be feathered out. It means it kind of vanishes out, right? It thins out from thick, thin, 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 thin. Why do you want to do that? Because when the technologist is evaluating the specimen, they look at the feathered edges. That is what they want to look at. Why? Because that is the smallest layer of cells that they can look at. And this test is usually done to perform what they call a differential count to see how many red blood cells the person actually has in their bloodstream. So you have to have this very thin layer so that the technologists can actually be able to count the number of cells. Obviously, they count a very small area, and then they have their formulas to perform that test. But again, it's not done very routinely, and there is machines that actually can do it for us, and they do it perfectly every single time. So routine blood film smear preparation again. Remember the characteristics of a good smear. Okay, these smears might be collected from an ADTA tube, right? So an acceptable smear covers about 1/2 to 3/4 of the surface of the slide. 1/2 to 3/4 of the surface of the slide has no holes, no lines, no jagged edges. Okay, and the thinnest area, properly made smear, often referred to as feathered edges. That is a properly performed smear, and we'll practice that in a class on our next meeting. Thick blood smears. Again, these are can be used for several tests, including malaria. They're diagnosed with the presence of organisms in the blood. Very large drop of blood is placed in the center of the glass. The drop is spread with the corner of another slide to cover slip until the size of a dime. Okay. So again, peripheral smears is one of the topics that is covered in your national certification exam, and it's important to you to know how the procedure is performed, what constitutes a proper or adequate smear, okay, so that you can be at least knowledgeable. Again, you may not be responsible to perform them. A lot of times they're left for the technologist in the lab that processes the specimens to do this for us. So don't worry too much about it, but you do have to know what peripheral smears are, how they're performed, and what constitutes a proper smear. Again, 1/2 to 2/3 of the slide have to be filled, okay? It has to be spread out, and the edges have to be feathered or very, very thin layer. That is the only way the technologist can have a good count of the cells. Okay, we've covered a lot of topics, okay? Different routines in capillary punctures. Make sure you're familiarized with the procedure itself, the proper way of collecting a capillary blood sample, when are they appropriate for children and adults. okay? And how to handle. We talked about the order of draw for capillary specimens, which is a little bit different. So make sure you're familiar with that. You know, by now you should know the difference between arterial blood, venous blood, and capillary blood. The types of patient specimens that are analyzed in the clinical lab. The phlebotomist role in collecting and supporting specimens. Remember that not all specimens are just, carried out in normal. Some of them have to be protected from light, such as your bilirubin. So some specimens have to be placed in ice, such as your capillary blood gases. Okay, so you make sure you're familiar with the handling of these specimens when transporting them to the lab. Okay. Um, some of the samples cannot be collected in capillary blood tubes. So again, remember those are usually your coagulation studies. Your blood gases is another one. Okay, your ESR, erythrocyte sedimentation rate, and some of the tests that require large amounts of blood, like blood cultures, cannot be performed in capillary blood gases. So take that into consideration when a patient may be asking you, well, in another hospital they did, a finger stick and they collected my sample that way. Well, maybe that was a different kind of test that could have been performed with capillary samples, but if that's not the case, they may not. If they continue to refuse, then obviously you have to communicate with your healthcare providers, or nurses, or doctors, and let them know that the patient has questions or doubts about the procedure. So refer them to that in that case. You should be knowledgeable about the equipment that is used in capillary collections. We talked about the various hematocrit tubes. Okay, we talked about the micro collection tubes, the capillary blood gas kits, the Lancet devices. We talked about the slides. Okay, and so you should be a little bit familiar with them, and we'll get to practice those in the next session. Um, how do you select the area for capillary blood collections on adults and children? Who can you collect it? Um, Children usually over 1 year, you can collect a capillary finger stick. Remember that safety is important, so you make sure they grasp more than 2 fingers on a child, usually preferably three fingers, that you don't injure a child. Remember, it's always in the distal area of the fingers, which would be the ends of the fingers, and the meaty part or the fleshy part. Okay, those are going to be your sites to collect sample. Remember that you have to arterialize your site to make sure it's warm so you have good adequate blood flow. Remember not to collect specimens when they are swollen, when you see redness or an infection, when there's edema or swelling. If there's any impaired mobility in that hand or arm, remember that. Any contraindications for you collecting specimens from that arm, make sure that are followed, such as history of surgeries, history of mastectomies, and so on. Dialysis grafts, it applies the same like venous punctures. The special precautions necessary during blood collections by venipuncture and capillary puncture. If you do collect a venous specimen and you place it on a capillary tube, make sure that you label the specimens as venous so that the technologists can understand and use the different reference ranges for the different types of specimens. So remember that. We've covered several topics again in capillary punctures, and hopefully you have a good idea of what a puncture site requires and what you can do and cannot do. If you have any more questions, please don't hesitate to send me an email, okay? And we can discuss this more in depth regarding about anything that we covered here in chapter 10. So for now, I'm going to end this lecture, and we can continue the discussion on our next meeting. So until then, we'll see you. Thank you for joining.